Welcome to Health Protocol Channel. Today's episode is all about varicose veins. This is a very common vascular issue, affecting up to 1 in 4 people. Varicose veins are swollen veins that appear just under the skin in your legs, feet, or ankles. When your vein walls are weak and your valves aren't working right, blood backs up in your vein. This causes blue and purple bulges. Treatments can work, but varicose veins can return. For most people, varicose veins aren't a major problem. Did you know that most people don't have complications from varicose veins? But an untreated varicose vein can cause ulcers, bleeding, inflammation, or skin discoloration. Severe varicose veins may be a sign of chronic venous insufficiency, CVI. This condition affects your veins' ability to pump blood to your heart. So, we're going to dive into what they are, how they develop, ways to reduce some of the symptoms, and ultimately, how to treat them. We've talked about arteries before, or if this video comes out first, we'll talk about arteries later. Arteries carry oxygenated blood away from your heart. Veins, on the other hand, bring deoxygenated blood back to your heart. Arteries have thick, strong walls, while veins are a bit more flexible, just to put it in perspective. Okay, so what exactly is a varicose vein? So, a varicose vein is when the valves inside the veins aren't closing properly. Inside veins, there are these one-way valves, right? To prevent blood from pooling downwards. If those valves aren't closing 100% along with gravity, we'll start to see some of that widening of the vein. And then, they start popping out and becoming like ropey snakes on the legs. That's the varicose vein. Got it. Alright, so there it is. Veins, trying to get the blood back to your heart, have little valves in them to let the blood go one way and not back the other. As you compress your muscles and walk, you push the blood, hopefully keeping it moving back to the heart. If those valves are incompetent, meaning they don't work effectively, the mechanism fails, and the blood doesn't return to the heart as efficiently. It then pools in those veins and makes them bigger, and you can actually see them through the skin. That's what we call varicose veins, okay? And so, there are both superficial and deep veins. Usually you don't, so you tell me. Which one's more of a problem? Or are both equally problematic? Both are. The deep problem is something I'll see in my patients who have a previous history of a blood clot. The blood clot damaged the deep veins, and that's when they'll come back with swelling in their legs, right? And you don't like swelling in the legs? Number right. No, that's uncomfortable, and people don't like how it looks either. Yeah. Okay, and then superficially, what kind of problem do the superficial ones cause? Most of my patients will come to see me for a varicose vein problem because they're actually having pain. They're having heavy, tired legs. They have pain in them, more so than for cosmetic reasons, actually. Okay, so you've got the spectrum of issues that can happen with this. From some unsightly veins you don't like the look of, to pain, swelling, heavy legs, to really having a problem with the tissues breaking down because the venous insufficiency is so severe. So, like a lot of things, there's a spectrum of problems that can happen with this condition. Yeah, so how do we treat it? So first off, we have to do an ultrasound to take a look to see which veins are broken. That makes a huge difference in terms of what kind of treatments we can offer for our patients. If the deep system is broken, a lot of times it's going to be compression stockings. It's going to be more healthy lifestyle things like aerobic activity for their legs, elevating their legs. I'll have some weightlifters. I'll ask them to actually do less weights, actually. Yeah, sure. Okay, I should pay attention to that. Do you do a lot of deadlifts? On a regular basis. Okay. And then that's just because during that activity, the amount of pressure increases? Yeah. If it's all about pressure, forcing all that pressure down the way. Sure. Valsalva. Yeah, exactly. They're stressing their veins out. What about diet? Is there anything we can take that's going to... First, let's start with reversing. Is there anything we can take that's going to make our varicose veins go away? Number. So, nothing. There are a lot of YouTubers that say, do this, this is going to make your veins go away naturally. So, we hope that what they mean is that this might improve some of your symptoms. It's definitely not going to cure your valve problem. Yeah, there's nothing that can do that. Never listen to YouTubers. Okay, so you can't reverse it, but can you prevent it? Okay. What kind of foods are we talking about, Bev? So, anything with flavonoids. Wow. Yeah. So, what has flavonoids? So, citrus fruit. Citrus fruit. You can get it in like grapeseed. Yep. Yeah. I believe blueberries. Blue. Yeah. Bilberry and horse chestnut. Yeah. Ah, the horse chestnut. Yes, one of my favorites. Right. So, mostly plants. Yeah, right. This is not for you keto and carnivore people. Your diet's not going to help your varicose veins. But I find that even for a diet, because you'd have to eat like 500 oranges or something a day. That's a lot of oranges. So, you can get supplements. Okay. There are vein supplements out on the market. So, if there are problems with the superficial veins, okay. On their ultrasound, there are treatment options. Okay. Typically, there is surgery. Okay. So that's literally taking out the broken veins. Right. It's been around for at least 50 years. Okay. There are more minimally invasive options. So, there's the endovenous laser ablation. Okay. Or thermal ablation. So there's radiofrequency ablation as well. So you're going inside of the vein. Yeah. Doing something to it so that the walls stick together. Yeah. And then, because all your veins are connected, it just moves the blood to other places. Right? Yeah. Okay. Yeah, so there's that. There's VenaSeal. So that's a medical-grade superglue to glue the vein shut. And if there are only like branch varicosities, and it's not the main system that's broken, there's sclerotherapy. Okay. So, when you say that, you mean injecting superficially or deep into the vein itself. Again, to collapse it. Yeah, okay. So, basically, if you're going to think about interventions for the veins, the options include some kind of surgical intervention. The non-surgical stuff has options where you can use a laser to burn the wall and collapse the vein, or radiofrequency, high-frequency radio waves, to burn and collapse. You can use a sclerosing agent, inject the vein, and that'll make it collapse and stick down. There are some glues, for lack of a better term, that you can inject to squish that vein down and stick it down. Or you can just take the vein out altogether. That's basically it. Yeah. So, lots of different options. Right. And it really depends on their anatomy, what their vein size is like. Intuitively, as I hear this though, you're going to deal with the veins that are broken. Yeah. You have other veins. Yeah. They have the same kind of genetic makeup. Is this not something that has the potential to come back? Oh, for sure. In the other veins? Yeah. Not necessarily the one that you've treated. That one's good. Yeah, it's a lifelong condition. Yeah. And how long would the average person get success? Like, obviously it's hard to say because every patient's a little bit different, but say at 5 years. How many of your patients that have some type of definitive treatment would be coming back saying, hey, my veins are bothering me again? So, if they have laser or glue, the success rate is about 98%. Oh, so a 2% recurrence rate. For surgery, it's about 10 to 15%. Okay. So, just the trauma from surgery. Some people like to grow new veins. Okay. So the neovascularization afterward. Okay. And when the veins grow back, they don't come back with valves. So, on ultrasound, you'll see like, instead of one big vein, you'll see all these little new growths everywhere. Straight tubes, no valves. Then they're all like gnarly, like snaky. Okay. So, that's why you're like, yeah, my grandma had vein stripping, but like, they're all back again. And depending on the country that you live in, what's covered by your governmental health plan, yeah, it's your insurance. Some of it might be out of pocket. So, obviously, have a discussion with your local healthcare provider. Yeah, definitely. It's going to vary from one region to another, how you get your veins treated, and how much it's going to cost you, if anything. But the good news is, if you have this condition, There are some very effective treatments, and a lot of different treatment options available to you. So, it's a kind of good news thing. Yeah, right. If you think about it, there you go. And if you like this video, please like it, subscribe to our channel. Dr. Chan, thank you so much for sharing your expertise and your experience with us and our viewers. And remember, you are in charge of your own health. We'll see you next time.